Hi, good morning, everyone. Welcome to this session of ENT. This is ear day now, and we are done till now the larynx, the nose, and the pharynx. And I hope you could revise a couple of things. And हमने on कर दिया. I hope you could revise a couple of things out of these three topics. I know this is a very challenging time when you don't have that much time available for the revision. And I can relate to, there are a lot of classes going on and there are only this much time left to revise and then, another day, another class. But just ask yourself one question that your seniors or your previous batch people also passed the same situation and they passed the exam. So it is a challenging time, no doubt about it. But you know what? We have to sail through this in a very systematic manner. In a more, I would say, stretch yourself. That's why I've been telling to you, in the usual 24-hour day, we don't get that much really, scope of revising if we are actually just following the previous routine we had. So when I say 5 hours, 6 hours sleep, I want to create a window for you guys to have more number of hours available for you so that you are able to revise. Even you get 2 hours extra apart from what you're getting now, believe me, in those 2 hours, at least you can revise major content what you did in the same day. So the baseline is that you must stretch your limits a little bit more, and then only the scope of revision would be, there. But just make sure that, don't lose heart. Don't lose heart, don't lose hope. That how will I do? Don't get, so much, I would say, overwhelmed by the classes and the material and all that. Because you know what, everyone passes through the same thing, that's what the doctors are actually. We are supposed to work under pressures. We are supposed to work and deliver under pressures also. And this is one of the time when you're actually passing through that time. And I know we have not passed through this kind of time too often in our life. But believe me, if our seniors could do, we can also do. Just remember that. If they could do all these, revisions and all everything, then they can also do better. Okay? Now. So, allow me to go now the next topic of the ENT ear, and thank you for your wonderful messages on the email and the telegram. And I'm really humbled by those messages. I'm glad that you're learning. That's a very, very important thing for me, that in an online portal we are able to deliver, so that you're able to learn the concepts of ENT. So I'm really very much, I would say, sort of humbled and happy to really hear that you are you're actually trying to absorb the concepts of ENT. Wonderful. So ear, first of all. Now, first of all, in ear, we talk about embryology, beta. Embryology. Open up your notes, beta. Embryology, everybody. Open up the PDF and now open the ear part of it. Now, everybody open the ear part of it. Now let's start the ear for the day. Ear. Everybody reach over there. Ear is at the page number 82. And please use these pages, beta. I have asked them to keep one extra page everywhere in between so that you can put extra things over here. Don't really use these pages, beta. There is an extra page over here in the beginning of every section. Use this page, beta. Okay. Now, the embryology, but embryological development of pinna. Let us discuss the development of pinna and development of other part of the ear. What are the important points to remember? First of all, pinna, development of pinna, put an arrow. It is from first and second arch, beta. Development of pinna is from first and second arch, beta. Development of pinna is from first and second arch, beta. First and second arch. 2 arches, first arch, second arch. Development of pinna is from 2 arches, first arch and second arch, beta, arch. 1 and 2 arches, beta, arches. I hope you remember arches, beta. Arches, 1 and 2 arches means on the surface of the embryo of human, we have got certain elevation, beta. If you remember, can you see, do you remember that, beta? On the fetus head and neck, this is a fetus head, beta, is forming. And can you see these elevations here, these elevation like focus? Can you see arches means elevation? These are arches, and first and second arch, they are actually the site where the pinna forms, beta. Okay, pinna form. Now see, please on the screen, beta. Now please see, everybody, see over here. This is your tragus, beta. Now this is T mane tragus. Okay, tragus. Now tragus is from first arch, beta. Just look at your notes. Tragus is from first arch, number one, and the rest of pinna from second arch, beta. Tragus develop from first arch, rest of pinna from second arch, beta. So tragus is having separate development, but tragus is a part of pinna, beta. Tragus develop from first branchial arch, rest of pinna from second branchial arch. Okay. Now see over here. Can you see this line, beta? Can you see this red line? This line is the union of first arch and second arch. And this line is called incisura terminalis. Okay, let us write out, beta. Incisura terminalis, beta. INCISURA. Incisura terminalis is the junction of first arch and second arch. Incisura terminalis is the junction of first arch and second arch. Mind you, beta, tragus is a part of pinna, but tragus is separate cartilage, but tragus is very well a part of pinna only. So tragus develop from first arch, rest of pinna from second arch, and incisura terminalis is the junction of first arch and second arch, and there is no cartilage in incisura terminalis, beta. In this area, there is no cartilage, beta. There is no cartilage in incisura terminalis, beta. There is no cartilage here, beta. Okay? There is no cartilage in incisura terminalis. So tragus is separate cartilage, rest of pinna is separate cartilage, but tragus is a part of pinna. Tragus develop from first arch, rest of pinna from second arch. Incisura terminalis is a junction of first arch and second arch, and this incisura has no cartilage, beta. Okay, fine. This much is clear. Now, what is hillocks of His, beta? Hillocks of His, beta. Now, please see when the human embryo is developing. Okay. Look at the last line, beta. Pinna development completes by 20th week, beta. Pinna development completes by 20th week of embryological life, beta. This is MCQ, beta. Pinna development completes by 20th week, beta. 20th MCQ, 20th. When the pregnancy is there, pinna develop by 20th week, beta. 20th week. Now let me show you the ultrasound of that time. When we do the ultrasound at 20th week. This is what it looks like, beta. Please see on the screen, beta. Can you see, beta, over here? This is the pinna, beta. Can you see a fetal ultrasound? And you can see over there that pinna is there, beta. This is the pinna over there. Okay, pinna over there. But you know what? It's not like that. The 20th week completed today and suddenly tuck pinna comes out. Not like that, na? It's not 20th week of pregnancy completed today and tuck pinna comes out suddenly out of the fetus head. No, no, no. What will happen? Look at screen, beta. Look, what will happen? First of all, 6 elevation will form. Okay, 6 elevation will form. These 6 elevation are called hillocks of His. Hillocks of His, HIS. They are 6 elevation, and then they fuse to form the final shape of the pinna. You understanding? First 6 elevation, hillocks means small hill. Hillocks of His means small hills are formed on the surface of the head of the embryo, and then they fuse to form the final shape of pinna, and final shape of pinna gets ready by 20th week of embryological life. Now everybody read, beta, hillocks of His, beta. Hillocks of His, just leave. During embryological development of pinna, 6 elevation form on the head and neck of the embryo, 6 area of embryo from first and second arches, which eventually fuse to form pinna, beta. Am I clear, beta? During embryological development of pinna, 6 elevation form on the head and neck area of embryo from first and second arches, which eventually fuse to form pinna, beta. These 6 elevation are called, everybody MCI question, hillocks of His, beta. These 6 elevation called hillocks of His. They are 6 in number, that's an MCI question, beta. These 6 elevation called hillocks of His, beta. HILLOCKS, hillocks of His. They are 6 in number. They are 6 in number, beta. And pinna development completes by 20th week is also the MCQ, beta. So 6 elevation is MCQ, 20th week is MCQ, beta. Now let us do the next topic. Congenital disorders of pinna. Disorders of pinna, beta. Now please see, can you tell me pinna develop from which 2 arches, beta? First arch and second arch, beta. First arch and second arch. I hope you know this diagram, beta. Pinna development from first arch and second arch, and this is a line of union of first arch and second arch. Imagine first arch and second arch do not unite with each other properly. Then there will be a sinus formation over here, and that sinus is called preauricular sinus. Preauricular sinus, beta. Everybody, first of all, look at the picture of preauricular sinus, beta. Can you see there is a hole in front of the pinna? A lot of time parents come to the clinic with the child and the child has got a hole in front of the pinna, beta. It's not just a hole, beta. It's not just a hole, it's a complete tract over here, beta. Only hole is visible. It's not just a hole, sinus is a complete skin line tract, beta. Why it happened? Please understand. Because first and second arches do not unite with each other properly. When first and second arch do not unite with each other properly, there will be a sinus formation between the two, and that is called preauricular sinus. It looks like an opening in front of the pinna, beta. Can you see opening in front of the pinna? You know, as a doctor, you are not a student anymore. You're going to be a medical professional. You should know as a doctor that, okay, there is a hole in front of the pinna. What I will think the name of disease is preauricular sinus. Now let us read about it. Preauricular sinus, if the union of first and second arch is incomplete, it will lead to a congenital disorder called preauricular sinus. Have you read it, beta? If the union is incomplete, it will lead to preauricular sinus. Now, it may be symptomatic, it may be asymptomatic. If asymptomatic, it needs no treatment. If asymptomatic, it needs no treatment, beta. It needs no treatment. If asymptomatic, it needs no treatment. But look at beta. But if there is a recurrent infection, can you see? This is sinus opening over here. The sinus tract got infected. Can you see red infection over there? If the recurrent infection is there, then the treatment is surgical excision. Okay? If asymptomatic, no treatment required. But if there is a recurrent infection, then surgical resection of the tract should be done. Am I clear, beta? Surgical resection of the tract should be done, beta. Okay, very good. Let's go further, beta. We are doing developmental disorder of pinna, beta. Okay. Now, what is anoxia? Anoxia is absence of pinna. Microtia is small pinna, beta. Anoxia is absence of pinna. Microtia is small pinna, beta. Anoxia, microtia. Am I clear, beta? Anoxia, microtia. Anoxia, microtia. Now, next one. Next one. Bat ear. Normal pinna has two curvatures, beta. Let us understand bat ear now, beta. Everybody, look at the pinna, beta. Very interesting thing. Look at the pinna, beta. Look at the pinna, beta. Please see, a normal pinna has two curvature, beta. Outer curvature, inner curvature. The outer curvature is called helix, beta. Helix is the capital C, and anti-helix is small c, beta. Please see, every pinna has two C, beta, two curvature. Outer curvature, capital C is helix, and the small c is called anti-helix. Of course, this is helix and this is anti-helix, beta. Am I clear, beta? So very simple. If you look at your pinna in the mirror, you will see there are two curvatures, outer C, inner C, beta. Outer C is called helix, inner C is called anti-helix, beta. Anti-helix. Okay. Now, if anti-helix is absent, if anti-helix is absent, beta, अगर anti-helix नहीं है, if anti-helix is absent, it is called bat ear, beta. If anti-helix is absent, it is called bat ear, beta. Look at the screen, beta, bat ear. Can you see bat ear, beta? Bat ear. Your pinna has two curvatures, beta. Look at your pinna, beta. Look at the pinna in your mirror. Stand up and see in the mirror, beta. Get active in the learning, beta. Oh, go. You're a doctor, okay? Okay. Look at your pinna in the mirror. There is outer curvature, inner curvature, beta. Outer curvature is called helix. In capital C is helix, small c is anti-helix. But look at the bat ear, beta. Bat ear only has helix, beta. Helix. There is no anti-helix in this, beta. This is suiting her, but it will not suit our children. If it happens in humans, in our children, they will look like aliens, you know. Remember Amir Khan, they look like aliens like that, beta. Okay. Now look at our child, beta. Can you see, beta, over there? Can you see over there our child? Don't you think so? It's looking like alien, beta. Can you see? Only helix is there, beta. Only helix is there. They're like open like antennas like that, beta. Antennas like that. They're roaming around like antennas. So there is no inner curvature, beta. So I know as a doctor that normal pinna has two curvature, helix, outer curvature, anti-helix, inner curvature. If anti-helix is absent, like this patient, beta, just see on the screen, there is no anti-helix over here. Its disease is called bat ear, and this is only a cosmetic problem. Okay, this is, please understand as a doctor, write down side one. Use the sidebar for extra concept, beta. Right now, it's only a cosmetic problem. Hearing is not a problem, beta. Okay, it's only a cosmetic problem. Okay. Now, please see on the screen and look at your notes, beta, that Normal pinna has two curvatures called helix and antihelix. If antihelix is absent, it is called bat ear. Bat ear. It is called bat ear. It is called bat ear, beta. Bat ear. The cosmetic surgery of pinna is called otoplasty. Auto means ear, plasty means repair. It is done at 6 years of age, beta. MCQ. What is the ideal age of otoplasty? 6 years of age, beta. Why? Because by 6 years, pinna gains adult size, beta. Because by 6 years, it has fully grown by the time. Am I clear, beta? Fine. MCQ, beta. Fine. Bat ear, otoplasty, 6 years. Lot of question here, beta. So, OT means pinna, beta. OT, otoplasty. OT means pinna. Can you see, beta? Anosmia. Can you see there is no pinna, beta? Anosmia. There is no pinna. Anosmia, A means absent, nausea. Okay, but microtia means small pinna. So OT means pinna. Otoplasty, है ना? Anosmia, microtia. I'm clear. Bat ear, I'm clear. Oh, bat ear is cosmetic problem, beta. Okay, and no problem. Now next one. Development of other structures, beta. Tympanic membrane develop from all three layers: ectoderm, endoderm, mesoderm. Development of other structure. Tympanic membrane develop from all three layers, beta. Ectoderm, endoderm, mesoderm, beta. Okay, one question. Now, development of ossicles. We're doing development of ear, beta. Development of ossicles. Malleus incus develop from first arch, beta. First arch. Stapes from second arch, beta. S for stapes, S for second, beta. S for stapes, S for second. Malleus incus develop from first arch, stapes from second arch. Anybody? Pinna develop from which arch, beta? First arch, second arch. Pinna from first arch, second arch. Ossicle from first arch, second arch, beta. Okay, bache? Pinna from first arch, second arch. Ossicles from first arch, second arch, beta. Am I clear, beta? Fine. Now, let us see the ossicle, beta. Let us label them, beta. This is M mane malleus, I mane incus, S mane stapes. Let us get familiar with the ossicles now. They are very small ossicle, beta. They are like rice grain size. Rice grain, you know rice grain? Rice grain size, beta. Rice grain, beta. Look at my hand, beta. In my this pinch, my pinch, 3 ossicle will come, beta. They're very small bone, beta. Rice grain, they're rice grain like. Somebody in Mumbai asked me, as a live class going on in Bombay, pre-COVID classes. He said, Dr. Rajiv, why you are giving always example of rice grain like that? Now, because I say corniculate, cuneiform cartilage, rice grain cartilages. Whatever impression you carry from your childhood, they are something which you start, giving as examples also. I told you because my father was having a small shop of ration. So I used to sit at the shop and you know what, whenever you are measuring anything, you're touching that and you know what, you develop your tactile memory from there. So in fact, that's why I keep giving you. In fact, that was the time which gave me real motivation that I have to do something else in my life actually. Otherwise, if I would not have passed the exam of the medical entrance, I would have been doing the same thing all through. It's not that that's a bad work. That's a lower. I'm not commenting on that. It's not that being a doctor is a really wonderful thing. I'm not saying that. It's just another profession. But yes, what you enjoy the most. What you enjoy the most. That you have to really see. And believe me, I never knew that medicine is going to be such an interesting thing, honestly. I never came to medicine by really information. I never had much of an idea. I took physics, chemistry, biology because my friends took physics, chemistry, biology. That's all. After my 10th class, I had to decide which way to go. I was okay in maths also. I was okay in science also. I was okay in everything also. I was okay in everything. No, not bad actually. Honestly, I was not bad. But I thought they are taking biology. I'll also take biology. At least we'll be going together to the school. You know what? So at that time, I never knew that medicine would be such an interesting profession. But today I can tell you, you're going to be the future doctors. You should know that this profession takes time to settle. Yes, challenges are there. But it's a very satisfying profession. If you practice it well, if you practice it little ethically, I'm saying, I'm not asking you to become gods, but if you still maintain the ethics of the practice, you practice in a scientific structured manner, you do justice to the patients, it's a lot of rewarding experience. Financially, of course, yes. Otherwise also, financially, I told you, money will come. But money is going. There will be a delay of some years, but eventually money start flowing from here and there. But that is not a problem. But it's a very interesting profession to be in. I'm really grateful that I don't know why, but I took physics, chemistry, biology in 11th class, and I came this route because now I feel that this is what I actually am meant for actually. Okay, because when I was in the shop actually selling all those things, I was not really very excited about it. Every day was the same day kind of thing. Every day when you go from school over there to the shop, you are measuring the same thing. 1 kg will remain 1 kg only. No changes in that. Not that that work is lower, but no work is lower, but no work, every work is having equal worth, I would say. Only thing is what you are meant for as a human being. And medicine is a very exciting profession to be in because a lot of human touch over here actually. Okay. So malleus, incus, stapes, they are like rice grain like cartilages. Now cochlea. Cochlea is derived from otic capsule, which is neuroectoderm. Cochlea is neuroectoderm. Why? Cochlea is like retina. Cochlea is like retina. Dr. Radha must have told you, in online classes about ophthalmology, and retina is like neural structure. Similarly, cochlea is a neural structure, and it develops from otic capsule or neuroectoderm. Neuroectoderm. Okay. Cochlear development completes by 20th week. How many weeks? 20. Cochlear development completes by 20th week. But 2020. Anybody? Pinna development completes by 20th week. Cochlea by 20th week. Ear by 20th week. Okay, fine. Am I clear? Beta? Fine. So cochlea, pinna develop by 20th week. Beta. Now next question. Which ear structure is of adult size at birth? Okay, adult size. Which ear structure is of adult size at birth? Beta? Okay, number one, middle ear. Number one, middle ear. Number two, ossicles. Number three, cochlea. Middle ear. Number two, ossicles, cochlea. Beta. Means that they do not grow after birth. They are already of adult size at birth, and they are okay, they are absolutely good size at birth, and they do not need to grow after birth. The middle ear, ossicles, and cochlea are of adult size at birth. Beta. Now, clinical anatomy. Master tip is absent at birth. Beta. It develop at 2 years of age. MCQ. Master tip develop at 2 years of age. Beta. 2 years. Everybody touch behind your pinna. Everybody touch behind your pinna. This is the master tip area. Beta. Master tip area. Okay. So master tip is absent at birth. It develop at 2 years of age. Beta. 2 years of age. Okay. Fine. Now, let us start a discussion of middle ear ossicles. Beta. Middle ear ossicles. Let us start a discussion of middle ear ossicles. Middle ear ossicles. Beta. Malleus, incus, and stapes. Malleus is like a hammer. Beta. Malleus is like a hammer. The three ossicles. Bolo beta. Naam bolo. The three ossicles. Number one, malleus. Number two, incus. Number three, stapes. Beta. M-I-S. Beta. M-I-S. Malleus, incus, stapes. Beta. Now, just write down size-wise. Malleus is bigger than incus. Incus bigger than stapes. Beta. If you look at a size, beta, you can look at size. Malleus is bigger than incus. Incus bigger than stapes. Beta. Okay. Now, all of you look at this one. Beta. This picture. Beta. Label it. This is what, beta. Everybody label it, beta. Label it. This is your tympanic membrane. Tympanic membrane. Okay. This is your malleus, incus, stapes, beta. Malleus, incus, stapes. Okay. Malleus, incus, stapes. This is which part of the ear? This is what? This is the middle ear, beta. M-E mane middle ear. This is what the inner ear, beta. I-E mane inner ear, beta. Okay, middle ear. Middle ear contains ossicle, inner ear contains cochlea, beta. Okay. So this is tympanic membrane. Behind that is malleus, then incus, then stapes, and then you have got inner ear, beta. Inner ear contains what? Cochlea, beta. Okay. Just a basic orientation. And you can see malleus like a hammer, beta. Hammer. Okay. Malleus is attached to tympanic membrane. First ossicle behind tympanic membrane is malleus. Next is incus, then is stapes, beta. Have you labeled this one, beta? Okay. Now, everybody, let us see a small, video clip to understand it better. Please see on the screen. This is tympanic membrane. This is incus, malleus, incus, stapes, beta. So tympanic membrane is there, okay. Now you are actually looking at tympanic membrane from all around. Tympanic membrane is the, the thing behind which is the ossicle. Now sound energy is entering your external auditory canal. It is going to touching your tympanic membrane. When tympanic membrane moves, the malleus move. When malleus move, the incus move. When incus move, the stapes move, beta. So this is a one system, beta. Tympanic membrane ossicle one system. So ossicles have got one assembly, beta. Assembly. Okay, like that. Malleus, incus, stapes have got one joint actually. They have got one jointed assembly like that. Let us do one thing. Let us separate them and let us see them one by one. Now this is malleus. Now this is incus. And finally this is the stapes, the third one. Stapes. So let us do one thing. Let us see the diagram of these ossicles. Let us know the various parts of the ossicles, beta. Okay, fine. Once again, beta, please see this concept is important, everyone. This concept is important, that when sound energy come, beta, when sound energy come, what happens is, please see, when sound energy comes in your external auditory canal, the tympanic membrane and ossicle move together. Sound energy is going, look at this, beta, tympanic membrane and ossicle, they move together. They move together and then they stimulate the inner ear, beta. Can you see stapes is moving like a piston? So moving like a piston, okay, piston. So this is one system, beta. One tympanic membrane and ossicle, one system. But let us know the ossicle in detail now, beta. Okay. Now the next topic, beta. Everybody open up your notes, beta. Size-wise, we have written already. Malleus, incus, stapes. Stapes, smallest bone of the body. This was a PMT question also. Remember, pre-medical entrance exam questions. Smallest bone of the body, stapes, beta. Now, malleus, first of all. Malleus is like a hammer. Malleus is like a hammer, beta. Now look at me, beta. Malleus is like a hammer. Now look at me, English word, hammer. I must have seen a hammer. Now hammer has got a head. Hammer has got a handle. Imagine hathodi, beta, hathodi. Hammer is hathodi, hammer. Every hammer has one head and one handle, beta. Now look at screen, everyone. This is the head of the malleus, beta. Can you see head of the malleus? This is called the handle of the malleus. And the tip of the handle is called umbo. Bolo beta kya? Umbo. U-M-B-O. Umbo, beta. Umbo. Okay. Now there is a process over here. And that process is called lateral process, beta. This side is lateral process, beta. And below the head, this area on this side is called neck of the malleus. Neck of the malleus. Am I clear, beta? This is neck of the malleus, beta. Let us revise everybody various parts of the malleus. Bolo beta, misal bolo. Number 1, head of malleus. Number 2, handle of malleus. Number 3, umbo. Umbo is tip of the handle. And number 4, lateral process of malleus. And number 5, neck of the malleus, beta. Neck of the malleus. Everybody clear, beta? Mainly 4 parts of malleus, beta. Now look at your notes, beta. Get familiar to all these words. Number one is the handle of malleus. Okay, handle of malleus, beta. Number 2, lateral process of malleus. Lateral means outward. Means towards tympanic membrane. Lateral means outward. Outward means towards tympanic membrane, beta. And then handle of malleus. And number 4, umbo. Umbo is tip of the handle, beta. So there are 4 parts of malleus. Bolo beta, what are 4 parts? Number 1, head of malleus. Number 2, lateral process of malleus. Number 3, handle of malleus. And the tip of handle is called umbo. Okay. Now number 2, incus, beta. Incus. Incus is a little smaller than that. Now incus has a body. Look at the screen, beta. Look at the diagram, beta. Incus has a body, okay, number 1. Number 2, short process, over here, beta. Can you see short process, beta? Short process. Number 3, long process. And the end of long process is called the lenticular process. Okay. Once again, speak with me. Incus 4 parts, beta. Body, short process, long process, lenticular process. Once again, speak with me. The 4 parts of incus are body, short process, long process, and lenticular process. Lenticular process, lens-like process, beta. Okay. The end of the long process is called the lenticular process. Once again, beta, what are 4 parts of the malleus, beta? The 4 parts of malleus are head of malleus, number 2, lateral process of malleus, number 3, handle of malleus, and number 4, umbo, beta. Okay. Same incus, 4 part. Rather than head, there is body. Rather than lateral process, there is short process. Rather than handle, there is long process. And the end of long process is like lenticular process, beta. Okay, fine, chalo. Now let's do the stapes, beta. Now stapes is like a inverted cup on a plate. Okay, inverted cup on a plate. It has got 2 parts. Can you see, beta, 2 parts? Stapes is like a cup on a plate. Look at my hand, beta. As if you kept a cup, inverted cup on the plate, beta. The cup, inverted cup part is called head of stapes or superstructure of stapes, beta. Head of stapes or superstructure of stapes. And the plate is called foot plate of stapes, beta. And the plate is called foot plate of stapes, beta. Am I clear, beta? Head or foot plate, beta. Am I clear, beta? So it is inverted cup on the plate, beta. Now, head, underline or, just cut it the word or, beta. Head is equal to superstructure of stapes and foot plate of stapes, beta. Now, foot plate of stapes, beta. Look at screen, everyone. Look at screen. Look at this picture, beta. Look at this picture, everybody. Please see. Look at this picture in your notes only. This is the stapes, beta. Stapes attached at, what is it, beta? Cochlea, beta. है ना, beta? The foot plate of stapes. Can you see clearly, beta? Can you see? The foot plate of stapes, this one, beta, this one. The foot plate is this one. It's attached to some part of cochlea. And a foot plate is attached to some part of cochlea. And it is attached to which part of cochlea? Now look at your note, beta. Foot plate of stapes, it is attached at oval window of cochlea. Foot plate of stapes is attached at oval window of cochlea. Oval window of cochlea. Am I clear, beta? Oval window of cochlea. Okay, oval window, okay, of cochlea. Okay. Now, stapes acts like a what? Stapes acts like a piston. Stapes acts like a piston. Piston. Look at my hand, beta. Look at my hand, beta. Stapes is like a piston. Beta. Stapes is the end of middle ear, beta. Stapes is the end of middle ear and beginning of inner ear, beta. Stapes is at the gate of the inner ear, beta. Stapes is the end of the middle ear and beginning of the inner ear, beta. So, stapes is attached, foot plate of stapes attached at oval window of cochlea, and it rocks the inner ear like a piston. It is actually the gate of the inner ear. So it is knocking at the gate of inner ear, beta. How does it knock? To make you hear, how does it knock? It knocks like a piston, beta. Stapes acts like a piston, okay, fine. Now look at screen, everyone. What do you mean by piston, beta? Now please see on the screen. Can you see the stapes, beta? Can you see the stapes, everybody? Can you see the tympanic membrane, malleus, incus, stapes, beta? Can you see, beta, over here? Once again, if you see, now please see, this is your exonotory canal, tympanic membrane, malleus, incus, stapes, and this is what, beta? Inner ear, beta, cochlea. This is a cochlea has two windows, beta. Oval window, round window. Oval window, round window. There's nothing at round window. But oval window has got stapes footplate attachment. Footplate of stapes attached at oval window of cochlea. Now look at the movement of the stapes, beta. Look at the movement of stapes. Can you see stapes, beta? Everybody look at the stapes, beta, over here. Focus on this area. How the stapes is moving, beta? It's like a piston. It's knocking at the gate of the cochlea, beta. Okay, can you see it moving like a piston? When it moves like a piston, what happens is the cochlea gets stimulated, beta. The cochlea gets stimulated when cochlear membranes move, beta. Due to stapes movement, cochlear membrane moves, the cochlea produces electrical energy, beta. Electrical energy goes to your brain, beta, and you hear it. Once again, please see, beta. Stapes acts like a piston. Stapes attached to oval window of cochlea. When the piston-like movement moves the fluids of the cochlea, the membranes of cochlea move like that. When membrane of cochlea move like that, the cochlea gets stimulated and it produces electrical energy which goes to the brain via which nerve? Eighth nerve, beta. What is eighth nerve? What is eighth nerve? What is the name of eighth nerve? Vestibulocochlear nerve. This is cochlea only. Vestibulocochlear nerve. This is cochlea only, beta. Okay? So stapes acts like a piston. Now if this piston is fixed, come back to the note, beta. If stapes is fixed, it will lead to a disease called otosclerosis. Very important topic, otosclerosis. Okay, beta, otosclerosis. Oto means ear, sclerosis means fixation, hard. If stapes is fixed, it will lead to a disease called otosclerosis. Okay. Can you see this picture, beta? Everybody? Can you tell me what is this ossicle, beta? M. What is M, beta? Malleus. What is it, beta? I. Incus. What is it, beta? Tympanic membrane. What is it, beta? E. A. C means external auditory canal. Okay. C means cochlea. And this is the problem, beta. Can you see around the stapes there is extra bone formation, beta? Can you see around the stapes there is extra bone formation, and that has caused the fixation of the stapes, and this is a disease called otosclerosis, beta. At least I should know what is otosclerosis first of all. That stapes is a piston. If the stapes gets fixed, jammed, and that disease called otosclerosis, beta. Now you tell me, beta, if stapes is jammed now, can you hear properly? No, because stapes has to act like a piston, free moving piston. But stapes is jammed here. Something has surrounded the stapes. How can the cochlea stimulate properly now? Okay. So if stapes is fixed, it will lead to a disease called otosclerosis. Beta. Very good. Chalo. Now middle ear mechanics, beta. Next topic, middle ear mechanics. Now I know by now tympanic membrane and ossicle work as one unit. Oh yes, I've seen. Tympanic membrane is attached to malleus, malleus to incus, incus stapes. It's one unit, beta. They work together. Okay? They work together. They work as one unit. This assembly conducts sound energy to inner ear, beta. I know. Stapes give sound energy to inner ear, beta. So middle ear has got one function of conducting the sound energy to the inner ear, beta. Am I clear, beta? Fine. Now look at this, beta. Malleus, incus, stapes, beta. And foot plate of stapes attached at the cochlea, beta. Fine. Okay, but can you see one thing? As you are going forward, the size of the structures is decreasing, beta. Malleus is biggest ossicle, incus is smaller than that, stapes is smallest ossicle, beta. As you are going forward, look at me, beta. As you are going forward, look at me, beta. As you are going forward, the structure size is reducing. Malleus, incus, stapes. Stapes is very small bone, beta. I hope you remember physics, beta. Physics says that whenever any energy, this is which energy, beta? Sound energy. Whenever any energy focuses from a big area to a small area, it will get amplified, beta. I hope you remember the basic common sense, beta. Whenever any energy, what is this energy, beta? Sound energy. Okay, it is hitting the tympanic membrane. That goes to malleus, malleus to incus, incus to stapes, stapes to the cochlea finally, beta. Okay, fine. So whenever any energy focuses from a big area to a smaller area, it will get amplified, beta. Amplified, beta. Okay. Now if you got in your phone, Instagram is open, Facebook is open, and YouTube is open, and your Telegram question are also open, beta. Every window is open on your tablet or iPad. Everything is open. And you are sometimes doing Telegram questions, sometimes doing your notes, sometimes you're doing Instagram, sometimes you're doing Facebook, sometimes you're watching a YouTube video also. Then your energy is dissipated in 5 different corners. Then you cannot have the amplification of your energy, beta. Humans are also, what is human, beta? Human is combination of 2 things. Energy plus a limited time span. Energy plus limited time. You have got energy and you have got a time span of 3 months. Energy plus limited time span, beta. Okay. Now, time span you cannot do anything. Time span is fixed for all. Everybody has got the same time for 3 months only. Today is 4th, Anna. So we have got limited time span of 3 months only. But energy is in your hands, beta. You want to invest the whole energy into one thing, study, there will be amplification of that. If you want to do 10 different things at one point of time, nothing is of much concrete impression for the brain, beta, unfortunately. If you hear a song, beta. If you hear one song, hear a song only, beta. For some time, for 3-4 minutes, forget about everything and just hear that song. Unfortunately, we were never taught all this in the school. We should have been taught. There should be a curriculum of living. There should be a curriculum of studying also. Why we are subjecting so many students to unnecessary, problems? I don't know why. I wish we could start it in India that, okay, there's a curriculum of living actually. There's a curriculum of studying also that, first of all, you are a wonderful human being. Whatever you are really great. Yes, you need to trim a couple of things out of you and you need to change your focus point in the area at the juncture when it is supposed to. At this juncture, you're supposed to focus all your energy. If you're focusing all your energy only on the books, there'll be amplification, beta. What is amplification? Brain will get a richer, deeper impression of that part of the notes or that particular question. Same is happening over here, beta. As you are moving forward, you are focusing same energy from a bigger area to a smaller area. It gets amplified. So that's why they say middle ear causes amplification of sound energy also, beta. Okay. Now look at the next point. Middle ear also amplifies sound energy. This amplification is called middle ear transformer ratio, beta. This amplification called middle ear transformer ratio. And in your case, if you amplify your energy, this will be a life transformer ratio, beta. Life transformer ratio, beta. Why not we? See, energy is energy, beta. Human is also nothing. What we are, we eat food, we create energy. We eat food, we burn that, create ATPs, and we are nothing but a source of energy. We want to utilize this energy for X thing or Y thing or Z thing. That decision is a conscious decision. You want to keep sulking all through the day. What if I fail again? What if I fail this time? I have less time. I have so many classes. How will I revise? What will happen? Will I recall? Will I not recall? You can keep on doing all those things, or you can just say, this factor is common for everyone. Let me try to put my best foot forward. Let us do our best. Let us forget the rest. Let us leave the rest to God, beta. Let me do my best. In the 3 hours left after the classes, how much can I study? I may not be fully. I can't revise fully. Whatever I can study, I should be doing that with a lot of focus, energy, enthusiasm, very well knowing that I'm not the perfect, I'm not the best, beta, but I'm trying to do my level best, beta. And that amplification will create a life transforming event for you. At least it happened in my case for sure. And I'm sure you can also do. If I can do, you can also do, beta. If a person like me who has got 100 ways of getting distracted, it's a very difficult thing for me to focus on one thing. I just cannot. It's not my inherent property, beta. Some people have got inherent. My wife has inherent property that she can focus on one novel and finish it one night. I cannot do that. I will never read. I don't read books actually. I don't understand the books honestly. Most of these so-called books and all beyond my comprehension. Even if she gifts me some book, it will take me months to complete that. I can't focus with that. That's not my inherent property. But what I do is, I keep working on myself. I keep working every day. I live a day. Okay, kal jo hua so hua, koi problem nahi. Today, I'll do things differently, beta. Let me see how much productivity I can generate out of the day, beta. Okay? And this amplification is called middle ear transformer ratio. And middle ear transformer ratio is 18:1. Can you imagine? 18:1 means you invested 1 rupee, it became 18 rupees, beta. 18 rupees. This is what can happen with you also if your mobile phone and tablets are free of clutters, beta. Free of clutters right now. And if your mind is absolutely focused in studying as much as you can, very well knowing that I'm not the best, I cannot predict my result, I cannot control my result, I cannot control the exam, but I can control my productivity in the day, beta. Then look at the amplification. 18 times, beta. 18 times, beta. The main function of middle ear is this whole thing is called impedance matching mechanism, beta. Impedance matching mechanism. Just remember this word. It's a very, very core concept of ENT. When you come for NEET PG, I'll definitely talk in detail about this, beta. Okay. Main function of middle ear is, this is a NEET PG question. This whole thing collectively called impedance matching mechanism, beta. Impedance matching mechanism. Now, let us go further, beta. Now we're going to discuss every part one by one. Pinna to the inner ear. Let us start from pinna. Everybody touch your pinna. Your pinna, beta. Not your neighbor's pinna, beta. I hope you are, if you are living together, three people, 3-4 people still living together, studying together, cooking together, being together. Let us hold hands of each other, beta. If you are 3 people staying or 2 people staying or 5 people staying together, if one of you feels low, it's your responsibility to pick that guy or girl out of that negativity and make sure that he or she also studies better. Why should we do that? Are we here to become, gods? No, not at all. Not at all, beta. We are trying to improve the grace element in our life, actually. The grace element is, have you heard the Newton story, beta? Have you heard, everybody looks at the Newton story. The Newton was lying under a tree and an apple fell down and he thought that this is gravity, which is pulling the apple down to the ground. But everybody forgot one thing. Everybody forgot one thing. At the place where an apple was falling down from the tree to the ground, at the same place, a tree was growing against the gravity upward. I repeat, at the place where the apple was falling due to gravity towards ground, at the same place that apple tree was growing against gravity towards the sky. If the apple falling towards gravity is your own effort, beta, energy, effort, then the tree growing against gravity towards sky is the grace element in your life, beta. Grace is unpredictable, undefinable element in your life, beta. You cannot define that. You cannot predict that. What will happen on the exam day? If you're stuck at 148, some 3-4 wild guesses might be correct on that day, and you stand on 152 and you pass the exam. What is going to decide that whether grace blesses you or not? This cannot be defined. But you can enhance the grace element in your life. How? By being generous to other people, by being kind to other people, by helping them out, not pulling anyone down. If someone is down, hold the hand and take him along. Take him along, you know what? If somebody doesn't feel like studying today, sit with him, make him revise something which you did just now. Talk to him that why you're not studying, let us sit together and study. All these things are going to increase the grace element in your life. All these things are not from any book, not borrowed from some concept like here and there. These are things which I've lived through, which I felt many times in my life actually. Something was not deserving something, I got it. I got it. I don't know why I got it. I don't know why I got that. I don't know why I got that. As a child, I always wanted to go to Paris. In my village in Amritsar, I was looking at the newspaper, and I was seeing the Eiffel Tower. I always wanted to go to Paris as a 10th class student, 9th class student. It was my dream to go to Paris actually. But can you imagine from a village in Amritsar going to Paris? It's not easy to really see the path. How will it happen in future? I became a doctor. Then I took an ENT. I came to Delhi. I am not a malignant person. I don't mean ill to anyone. And I was in Coimbatore for a conference of otology, of 4 days, Coimbatore conference. And 4th day, they had a viva and a theory paper, multiple choice question paper for a fellowship, travel fellowship, which I never knew it's for Paris actually. I thought it's they sponsor some doctors, 2 doctors every year for learning for 3 weeks, ear surgery. I paid in that MCQ test, I passed it. Next day, the 8 people were shortlisted. Only 2 had to be given the fellowships. Out of 8, 2 were girls, 6 were boys. They always choose 1 girl and 1 boy. Out of 6 boys, only 1 had to be chosen. They were, all 5 were really much above me, honestly speaking. Much above me from all sort of possibilities. We appeared in the interview. It went well. In the evening, it was announced that my name, Rajiv Dhawan, is selected for travel fellowship to Paris. I was shocked. I was not knowing that it's Paris. Just for travel fellowship, I said. Must be in India only. To Paris with one of the most famous ear surgeon of France. His name is Andre Sultan. They gave me tickets. They gave me place to stay for 3 weeks. They gave me money for the lunch and dinner. Breakfast is with the professor. Always. Is it not grace, beta? Is it not? I never deserved that. All the people were much better than I was. How come it happened to me? And I reached Paris. Every night I used to catch metro from my apartment. I used to go to Trocadero. Trocadero is the name of the metro just below the Eiffel Tower. Every night I come out to Trocadero metro and look at the Eiffel Tower and look at the Eiffel Tower, and I used to sometimes get tears in my eyes, like that. That what is this? You know what? I never deserved it. I just thought about it as a child. How come it happened? I don't know. Is it from a book? No, it's my experience when I say that. When you're genuinely generous to other people, the grace blesses you. The nature is watching you. We all are collection of energy. Let us hold hands. May everyone pass. May everyone pass, beta. None of you should really leave a single opportunity to help your fellow beings, because you're not just helping him or her, you're helping yourself also. You're increasing the grace element in your life Sometimes you get stuck at 147, 146, and you never know. 5, 6 question wildly guessed by you got correct, and you got 154, 153, and you passed the exam. And suddenly the whole thing changes in your life. Everybody looks at you as like wonderful doctor. So why not do that? Not for other people, for us. For us, it's good to become generous for not for other people. Not it's again this selfish reason over there to increase the grace element in your life. So today, let us promise. If we see one person low, we'll make sure that he gets better. If a roommate feels low, we'll not leave his hand. If a roommate is getting annoyed with something happening in the room, we'll make sure that we don't do that to disturb him. If you deserve to pass, if you belong to one parents, then that person, that girl or that boy also belong to one family. Both families invested so much of money into the career of their children. Everyone deserves to pass. So may everyone pass. So let us hold hands and work on this together. May God bless everyone. May God bless your hard work. I cannot predict your result. I can tell you the ways to enhance the possibility of your passing better. And this is one of them. Now pinna. Pinna is made of yellow elastic cartilage, covered by skin. Of course, touch your pinna, not other person pinna, your pinna beta. This is pinna. It's nothing but cartilage and skin. Skin is closely attached to cartilage on the lateral surface. Beta. Skin is closely attached to cartilage on the lateral surface, means front side. Beta. This is lateral. Beta. Everybody mark it. Beta. No confusion. Oh, this is lateral surface. Beta. Lateral surface. Okay, this is lateral surface. Beta. Skin is loosed on a medial surface. Medial means the back surface. Beta. Back side. Back side towards skull. Okay, fine. So I can touch, beta. All of you touch your skin on the cartilage. It's actually closely attached on the lateral surface. If you all of you touch this area, beta. If you touch the skin on this area, it's actually closely attached to the cartilage, but on the back side over here, beta. On the back side, it's little loose, beta. Little loose, beta. Okay. Now, nerve supply of pinna. Very important nerve is greater auricular nerve. Greater auricular nerve, beta. Main nerve supply of pinna is greater auricular nerve, beta. It is the main nerve supply of pinna. It also supplies lobule of pinna. And write down one more question. New question for general surgery. This nerve can be damaged in parotid surgery. This nerve can be damaged in parotid surgery, beta. Parotid surgery, beta. Here. The parotid is here now. Look at everybody. Ear, below the ear is which gland? Parotid gland, beta. Okay. Okay. Fine. So how do they, what is lobule of pinna, beta? What is lobule of pinna? Please see on the screen. This is the lobule of pinna, beta. Everybody mark it, beta. Lobule. Lobule is the soft part of pinna, but this is the lobule of pinna, the soft part of pinna. How will they make a question? Patient suffering from pleomorphic adenoma of the parotid gland underwent a superficial parotidectomy. After the parotid surgery, the patient is complaining of loss of sensation in the lobule of pinna. In the lobule of pinna, the loss of sensation is there. Which nerve got damaged? The answer is greater auricular nerve. Beta. Greater auricular nerve. Beta. Greater auricular nerve. Beta. Am I clear, beta? Fine. Is it clear to everyone? Okay, fine. Next one, beta. Next, let's do, beta. Disorder of pinna, beta. Number one, pinna hematoma. Pinna hematoma, it is due to trauma, beta. Pinna hematoma is very common, and you know, a lot of people fight, a lot of people get injured with each other. They fight and then they hit each other, and then they get hematoma, beta. Can you see, beta? Injury, beta. Somebody punches with love on your pinna, and you get a beautiful hematoma like that, beta. Beautiful hematoma. So pinna hematoma, look at your notes, beta. It is due to trauma. Trauma. Can you see trauma, beta? Trauma. Something happened like that. Due to trauma. It is subperichondrial hemorrhage. I hope you know, the cartilage is covered by perichondrium, so it is below that, beta. Subperichondrial hemorrhage. Treatment is aspiration or drainage plus pressure bandage. MCQ, beta. You should do the aspiration or pressure bandage, beta. Yesterday class. Septal hematoma, look at, beta. Trauma. Look at me, beta. Septal hematoma. Remember my friend's story who had an accidental, injury by the gate of the mall. Septal hematoma, what was the treatment of my friend actually? aspiration. Otherwise, it will convert to septal perforation. Similarly, if you don't do this, otherwise it will lead to necrosis of cartilage, which leads to post-traumatic pinna deformity. And that pinna deformity is called as boxer ear or cauliflower ear, because it is more common in boxers. Beta. If pinna cartilage is necrosed, pinna shape is lost. Am I clear, beta? Okay. Otherwise, it will lead to necrosis of cartilage. It will lead to, which leads to post-traumatic pinna deformity called as boxer ear or cauliflower ear. Beta. Boxer ear or cauliflower ear. Okay. Can you see boxer ear or cauliflower ear, beta? This is the boxer ear, beta. Put an arrow like that. This is the boxer ear, beta. Very simple, beta. If you don't drain or aspirate the pinna hematoma, it will damage your cartilage, and the cartilage damage will lead to shape of the pinna being deformed, and that deformity of pinna after trauma is called boxer ear or cauliflower ear, beta. Is it clear to all, beta? Clinical topic, beautiful topics, beta. Now, keloid pinna, beta. Just a visual question. Keloids, I hope you know keloids from surgery, keloid hypertrophic scar and all that. Pinna can be site of keloid. Pinna. And most commonly it's seen on hallux, beta. Beautiful laddu, beta. Can you see laddu, beta? Beautiful laddu, and it is on which part? Hallux, beta. Why? People do the piercings over here. Nowadays, people want to put not one earring, beta. They want to put 10 earrings, beta. And people have a tendency to make keloid. So they get a punching of the hole over here, and then at that hole, the keloid form. Not everybody will make a keloid, but some people have got a tendency to make keloids, beta. Next one, Darwin tubercle. It is an anatomical variation. It's not a disease, beta. Darwin, you know Charles Darwin, remember evolution, beta? It's a conical elevation on hallux, beta. Hallux. This is the Darwin tubercle, beta. Everybody mark it, beta. This is the conical elevation of hallux. Darwin tubercle is not a disease. It's a conical elevation of hallux. It's only anatomical variation, beta. It's only anatomical variation, beta. Am I clear, beta? Okay, fine. So Darwin tubercle is clear. Now, let us start the next beautiful topic. External auditory canal, also called as external auditory meatus. We will call it EAC. For us, EAC is external auditory canal, beta. From now onwards, it can be canal or meatus, but we'll call it canal, beta. Canal. EAC means external auditory canal. Now, what is external auditory canal, beta? Everybody look at screen, beta. External auditory canal means when you go inside the from pinna, when you go inside, this is external auditory canal. Can you see, beta? Can you see, bache? This is external auditory canal. Can you see outer part has got hair follicles, hair follicle. And when you go deeper in the external auditory canal, at the end you see which membrane? Tympanic membrane, beta. Okay, once again, beta. This is the external auditory canal, beta. This is the external auditory canal, beta. Can you see external auditory canal? From pinna you are entering, beta, over here with endoscope. Outer part has got hair follicles, beautiful hair follicles. The moment you go deeper into it, inside there is no hair follicle, clean, ear is clean. And what is the end of the external auditory canal? Which membrane? Tympanic membrane is attached over there, beta. Okay? Now let us discuss this. I hope you're enjoying ear, beta. It's like understandable. None of you would try to memorize anything today. No memorizing pressure on you. Only understanding responsibility. There are notes in front of you. There are diagrams in front of you. Everything is there. Only live the moments with me, beta. Understand the anatomy with me. Live the clinical things with me as you're standing with me in the hospital with the clinic like that, beta. Okay? So that we are confident doctors of the future. Okay? EAC is 24 millimeter in length, beta. 24 millimeter in length. Outer 8 millimeter is cartilaginous. Inner 16 is bony, beta. Outer 8 is cartilaginous, inner 16 is bony. Okay? The bony EAC is made by tympanic part of temporal bone. Bony EAC is made by tympanic part of temporal bone. Yes. Now everybody label it. This is which bone, beta? Temporal bone, beta. This is temporal bone, beta. Okay? Now this is your external auditory canal, beta. Everybody put an arrow. This, I'm talking about this one, beta. This is what the M, beta. M is what? Mastoid part of temporal bone. Mastoid part of temporal bone. Okay, beta? Axonotory canal. This is tympanic part of temporal bone. Right on tympanic part. You should get used to the temporal bone, beta. Ear is designed within temporal bone, beta. This is a temporal bone, okay? Now, all of you, where is the temporal bone? On the side of the skull, okay? This is which part of temporal bone? This is the tympanic part of temporal bone, beta. And all of you palpate behind your pinna, beta. All of you palpate behind your pinna. What is this, beta? This is mastoid part of temporal bone. All of you palpate behind your pinna. This is mastoid part of temporal bone, beta. Guys, we think mastoid is behind the ear. Don't you think so? We have a concept, oh, mastoid to kaan ke piche hota hai. Mastoid is behind the ear. Why? Mastoid is not behind the ear, beta. Mastoid is a part of the ear. Mastoid is a part of the ear, my dear friends. It's a very well a part of the ear. Mastoid is a part of the ear, beta. Okay? Why we get this impression? You know, why we think pinna is the ear, beta. Please understand. Somewhere we start thinking pinna is very important design of the ear, beta. Pinna, look at my pinna, beta. Pinna is nothing, beta. Is a cosmetic structure only, beta. Pinna has got, if you chop your pinna, there will be no hearing problem. There's no hearing problem. If your inner rest part are working normally, if you chop your pinna, there won't be any hearing loss, beta. Pinna is more cosmetic thing. Don't think this is the ear, beta. Ear starts and ends over here. Ear is three-dimensional thing like this. Pinna is only attached to your skull so that we look presentable at least. If there's no pinna, we would have looked like boiled eggs, beta. You know, aliens, remember? Jadoo yaad hai? Koi mil gaya. All aliens, E.T., you know, aliens. If there is no pinna, we'll look like boiled eggs, beta, boiled eggs, like aliens, you know, remember? You know, why there are eyebrows, beta? Why the eyebrow also cosmetic, beta? It's not that eyebrows are catching the Wi-Fi signals. Do you think eyebrow catch the Wi-Fi signals? No. Do you think that eyebrows, when it is raining, they come out and cover your eye? No, nothing like that. It's only cosmetic again, beta. Why? Nature wants species member should find each other attractive. Species members should want each other. Species members should like each other, should find each other attractive, beta. You know why? What is the basic instinct of the brain, beta? Brain wants to make babies, beta. Brain wants to make baby. Brain is the inherent structure designed by nature to create more humans so that nature keep experimenting out of the genetic pool, beta. That is what. All these things are to create attraction amongst each other. That's all. Hair, eyebrows, pinna. They're like just to make you look presentable at least. Otherwise, kaan nahi honge. Can you imagine? How will I look like? Can you imagine? Almost remove my hair, remove my eyebrows. I look like a boiled egg. So, pinna is not the end and the beginning of ear, beta. Ear is three-dimensional thing like this, and mastoid is a part of the ear, beta. Okay, everybody? Now, one more concept, bache. Everybody, look at screen. Where is the temporal bone? This is your temporal bone, beta. Okay, can you see temporal bone, beta? And I'm sure you know this is the tympanic part of temporal bone. This is mastoid part of temporal bone, beta. One part of temporal bone is inside the skull, beta. Can you see, beta, the actual temporal bone, beta? Oh, anatomy. This is the tympanic part of temporal bone, mastoid part of temporal bone. Ear, mastoid is a part of the ear, beta. Am I clear? Now see on the screen, beta. Temporal bone, okay. Now my concern is temporal bone has got a very big part in the skull also. Temporal bone is not only the outside, beta. This also is temporal bone, beta. Everybody look at screen, beta. This is also temporal bone, beta. This is called the petrous part of temporal bone. This is called the petrous part. Temporal bone is going in the skull like this also. Outside tympanic part, mastoid part. What is the inside part? Is the petrous part, beta. Petrous part. Now look at me, everyone. Look at me, everyone. When I say external ear, middle ear, inner ear. When I say external ear, look at me. We are going in the skull, beta. External ear. Then you say middle ear. Then you say inner ear. Where you are going? You are going deeper and deeper into temporal bone. External ear, middle ear, inner ear. Over here, beta. Ear is located within temporal bone, beta. Now please look at screen, beta. Look at screen, everyone. When I say axonotory canal, it's within over here, beta. Tympanic part. Then comes the middle ear. Malleus, incus, stapes are here only, beta. Within the temporal bone. When I say inner ear, beta, cochlea, it's here only, beta. In the temporal bone. In the temporal bone. External ear, middle ear, inner ear, beta. External ear, middle ear, inner ear are lying deeper and deeper into temporal bone. What lies over here, beta? What lies over here is brain, beta. You know brain? Brain over here. From the brain, two nerves come, beta. Seventh nerve, beta. What is seventh nerve? What is seventh nerve, beta? Seventh nerve is what? Facial nerve. Facial nerve, beta. And that passes through the this is seventh nerve, passes through the ear and comes out, beta. Comes out. Let me draw with other color, beta. Let me draw with other color. This is a facial nerve. It passes through the ear and comes out, beta. Okay, bache? Fine. And then comes the eighth nerve, beta. Eighth nerve enter the ear and splice the inner ear, beta. You know what is eighth nerve, beta? Look at this, eighth nerve is seventh nerve is facial nerve. It passes through the ear and comes out of the ear to splice the face bit over here. But eighth nerve, the vestibulocochlear nerve, is going to splice the cochlea bit, inner ear. Eighth nerve is for inner ear. Eighth nerve is for inner ear. Vestibulocochlear. Vestibulocochlear is the inner ear beta. So eighth nerve. So look at the design beta. External ear, middle ear, inner ear, brain. External ear, middle ear, inner ear. What is next to the brain? Same on this side also beta. External ear, middle ear, inner ear, brain beta. So both sides, temporal bone, temporal bone. External ear, middle ear, inner ear, brain. And same external ear, middle ear, inner ear, brain beta, brain. What connects inner ear to the brain? Which nerve? Eighth nerve. What connects inner ear to the brain? Eighth nerve beta. What is eighth nerve? Vestibulocochlear nerve beta. And facial nerve passes through the ear and it comes out to go to the face beta, face. I hope this is clear to you. Now, let us go further beta. EAC is lined by skin. Everybody? EAC is lined by skin. Outer part skin has hair follicles and ceruminous or wax gland beta. The wax glands are also called cerumen. Cerumen means wax beta. Ceruminous gland or wax gland, which are modified apocrine gland beta. From the histology perspective, wax gland are modified apocrine glands. Modified apocrine glands beta. Okay, fine. Now, some people produce more wax. Can you see? Some people produce more wax, which leads to occlusion of EAC by wax collection beta. Can you see beta? Some people produce more wax. Can you see? Kaan pura band ho gaya. The EAC occlusion due to wax collection. This leads to CHL. Yes, what is CHL beta? Conductive hearing loss. How much? 30 decibel beta. MCQ 30 decibel. You cannot hear any sound up to 30 decibel. This is 30 decibel. You cannot hear any sound up to 30 decibel beta. Treatment is syringing. Treatment is syringing beta. Treatment is syringing mera bache. Syringing matlab you put water in the ear to flush the wax out bache. So can you see beta over here? Can you see syringing beta? Treatment is syringing beta. Can you see? Put water carefully. If you don't put water carefully, it will come to your face beta. It will splash on your face. Oh, it went on her face beta. Did you see that? This is what syringing. You're putting water in the ear to push the wax out beta. Okay? Now please see some questions beta. The direction of water is posterior superior. The direction of water is posterior superior. Very famous question. What is the direction of water in syringing is posterior superior. Direction of water is posterior superior beta. This is important question. Which direction you put the water? Posterior, superior? No, posterior superior. It will hit over there. It will touch the wax and wax will flow out beta. Posterior superior beta. Direction of water is posterior superior beta. Use water at room temperature. Avoid cold water. MCQ beta. MCI question. Avoid cold water because it can lead to vertigo. It can lead to vertigo beta. Avoid cold water because it can lead to vertigo. If you stimulate your inner ear with cold water, you can feel imbalance. You know, imbalance means vertigo. So don't use cold water because it can lead to vertigo beta. Vertigo. Now on the side, write down. One more question. Syringing can lead to syncope episode. Patient बेहोश हो जाता है. Patient can suddenly turn unconscious during syringing. Okay, syncope or vasovagal episode. Vasovagal. Remember vasovagal episode, beta? Vasovagal episode. Remember in your school time when you have not eaten anything and you are standing in the prayer, in the assembly, morning assembly, and suddenly you feel, there is black, you see black, and then you fall on the ground only, beta. Because you suddenly, you just fall on the ground. Have you felt that ever? When you're not eaten the breakfast, you're not had the breakfast, you're standing in the morning assembly queue, over there, and then suddenly everything turns, little, hazy, fuzzy, and your eyes are getting, blurring, and then blackout, and then you fall on the ground, beta. Even syringing can do the same thing, beta. Syringing can lead to syncopial or vasovagal episode, MCQ, beta, because of stimulation of auricular branch of vagus. Auricle mane pinna, auricular branch of vagus, beta. Okay, so this is an important question for MCI paper, NEET PG paper. Syringing can lead to syncopal or vasovagal episode due to stimulation of which nerve? Auricular branch of vagus, beta. I hope you know vagus is parasympathetic nerve. Vagus leads to bradycardia. है ना? Vagus stimulation will lead to bradycardia, na? Vagus carries parasympathetic innervation, beta. Okay, so why people develop vasovagal or syncopal episode? मतलब they turn unconscious suddenly due to stimulation of which nerve? Auricular branch of vagus nerve, beta. Am I clear, beta? This is MCQ, beta. Important question, already came in MCI, beta. Okay, chalo. Next one. Direction of ESC. Look at me, beta. Look at me, beta. Direction is tortuous. It's tortuous. In adults, direction is tortuous. Tortuous, beta. It is inward, downward, and forward. Look at me, beta. Look at me. Look at me. Of course, skull mein inward, inward, little downward, and then forward. Inward, downward, forward. Inward, downward, and forward. Therefore, look at the screen, beta. Therefore, look at the screen, beta. When you are examining the ear, can you see the doctor is pulling the pinna? Doctor pulls the pinna in reverse direction. If canal is directed inward, downward, forward, the examiner pulls the pinna upward, outward, and backwards. Write down. During examination of ear, pinna is pulled upward, outward, backwards. Upward, outward, backwards. Upward, outward, backwards. Okay, bache? That was inward, downward, forward. This is reverse of that. Upward, outward, backward. Upward, outward, backward. This is which test? But this is what being done. Otoscopy. Otoscopy. Otoscopy has got what? A light bulb and magnification. Light bulb and magnification, beta. Light bulb and magnification. Okay, bache? Fine, beta. Light bulb and magnification also, beta. Okay, bache? Fine. These are light source. Have you heard the word ophthalmoscope? Same otoscope. Light source and magnification, beta. Okay, fine. Chalo. Let us do the next one. Fissure of Santorini. These are some natural defect. There are some natural defect. These are, beta. These are some natural defects in EAC in cartilaginous part, beta. Okay. What are fissure of Santorini? Every person has got some defect in the cartilaginous part of the EAC, and that cartilaginous defect in the EAC is called fissure of Santorini, beta. Fissure of Santorini. Okay, bache? Fine. Am I clear, beta? Okay. What is the significance, beta? EAC infection can reach the parotid gland. How EAC infection reaches parotid gland, beta? Logical question. I've seen couple of patients. Look at me, beta. This is extranauditory canal, which is this gland, beta. Which is this gland? Parotid gland. Is there an EAC infection that can go to parotid gland through which anatomical area? Fissure of Santorini. Think like a doctor, not just anatomist, beta. Think like a doctor. Fissure of Santorini is a natural defect in the cartilaginous part of the EAC. Agreed. But what is the importance of this is, through the fissure of Santorini, EAC infection can reach the parotid gland, and that is the clinical significance of this, beta. So, clinical anatomy. Okay. Now, next question, beta. Live insect in the EAC, beta. Live insect in the EAC, beta. Live insect in the EAC, beta. Live insect in the EAC. Oh, तुम्हारे कान में कॉकरोच चला गया. cockroach goes in the ear, beta. Live inside the EAC, beta. Look at screen, everyone. Can you see there is a cockroach in the ear, beta? Can you see there is a cockroach in the ear? And cockroach is dancing like that. Oh, dancing. Would you try to remove it live, beta? You tell me. Would you try to remove this cockroach live, or will you kill it and then remove it, beta? Don't try to remove it live, beta. Why? Because it might be holding your tympanic membrane also, and when you put the cockroach out, the cockroach brings your tympanic membrane also out, beta. You don't want that? No, na. First kill it. Kill it, beta. Killing doesn't mean that. Killing doesn't mean that you put hit spray, black hit spray, kala hit spray in the ear. Cockroach, hai na? No. Red hit spray. No, bhai. No, not that. No hit spray, beta. Put oil in the EAC to kill it and then remove it, beta. Put oil in the EAC to kill it and then remove it, beta. Okay? This is MCQ. Practical question, beta. Okay? Put oil in the EAC to kill it and then remove it, beta. Which somebody asked me, which oil, sir? I said any oil except kerosene oil. Any oil. Particularly mustard oil is very commonly available, but no, not kerosene oil, beta. Okay? Fine. Now comes the sensory nerve supply of EAC. Everybody come to the next page now. There are three nerves, beta. Three nerves. Number one, right on. Always put the numbers, beta. 1, 2, and 3. Okay. Now, first of all, auriculotemporal nerve. Look at the auricle, mane pinna, temporal bone. Auriculotemporal nerve. It supplies anterior wall and roof of EAC. Anterior wall and roof of EAC. Beta. Okay, bache. Then come the auricular branch of vagus nerve. Vagus nerve. Put an arrow. This is same thing. It is put an arrow. It is also called Arnold's or Elderman's nerve, beta. It is also called Arnold's or Elderman's nerve, beta. Arnold's nerve or Elderman's nerve, beta. Okay. Now, stimulation of this nerve leads to cough. Very, very important question. Cough, beta. Have you seen this nerve is so important, beta? So many questions on this nerve, beta. Auricular branch of vagus, it can lead to vasovagal episode or syncopal episode. Or when you are cleaning the ear, patient suddenly started coughing. Why? Which nerve got stimulated? Auricular branch of vagus. Vagus leads to cough, beta also. This is clinical anatomy. Very possible question in NEET PG or the MCA paper also, beta. Stimulation of this nerve leads to cough, beta. They will make a story. A doctor was cleaning the ear of the patient with cotton. Suddenly, patient started coughing. Which nerve has got stimulated? Auricular branch of vagus, also called as Arnold's nerve or Elderman's nerve. Bolo beta, what is the other name of auricular branch of vagus? Arnold's nerve or Elderman's nerve, beta. Okay, beta. The third one, sensory division of facial nerve, also called as nerve of Würzburg, beta. Nerve of Würzburg. Okay, facial nerve. Okay, also nerve of Würzburg. It supplies the posterior superior part of the EAC, beta. Only small part. Everybody draw. Only this much part of the EAC, beta. Put an arrow. It only supplies very small part of EAC. Posterior superior part of EAC. Only very small island of the EAC. Posterior superior part of the EAC, beta. Posterior superior part of the EAC. Okay, bache. Let us revise this, beta. Let us revise this, beta. There are three nerves which supply the EAC. Everybody speak with me. Number one is auriculotemporal nerve. It supplies the anterior wall and roof of EAC. Then comes the auricular branch of vagus, also called as Arnold's nerve or Elderman nerve. It supplies the posterior wall and floor of the EAC. Stimulation of this nerve leads to cough, beta. Okay? This is very important, beta. Okay. The third one is sensory division of facial nerve, also called as nerve of Würzburg. It supplies posterior superior part of EAC, beta. May I remind you, none of you should try to remember anything at this point. Understand it, get used to the notes, what is written where, make a concept, beta. Oh, think like a doctor. You are doing syringing, patient turned unconscious. Which nerve got stimulated? Auricular branch of vagus. You were cleaning the ear, patient started coughing. Which nerve got stimulated? Auricular branch of vagus. What is the other name of auricular branch of vagus? Arnold's nerve or Elderman's nerve. This is how I want you to spend the day. Okay? Now, disease of EAC, beta. Disease of EAC. Number one, diffuse otitis externa. It includes the infection of complete skin of the EAC and or pinna, beta. Look at the name, diffuse mane pura otitis externa means that the outside ear got infected, beta. Outside part of the external ear. So it is infection of either pinna or EAC or both, beta. Okay? EAC and or pinna. Okay. Treatment is topical antibiotic and eardrop. Can you see, beta? The whole pinna and the ESC skin is infected. No question, for only for your clinical knowledge. If you see something like this, call it otitis externa, beta. Okay. It's also called, swimmer ear, tropical ear, okay, Singapore ear or telephone ear, beta. Okay. Now, why it is called swimmer ear? Beta, swimmer ear is the main thing, beta. If you don't want to remember anything, please remember swimmer ear, beta. Don't forget swimmer ear, beta. Why? Moisture goes in your ear and that moisture facilitates the bacterial growth over there, and that's why it's swimmer ear, beta. Okay, fine, fine, beta, fine. Chal. Just mark over Singapore ear, beta. Put an arrow. Singapore ear is just deleted over here, beta. There's a controversy on this topic, beta. Delete Singapore ear, beta. I'll tell you, there's a controversy going on this Singapore ear. Let's not make the name of a country actually. Okay, swimmer ear is the main thing, beta. Swimmer ear, beta. Okay, fine. Why tropical ear, beta? Tropical climate is humidity, beta. Humidity supports bacterial growth, beta. No question on this. Only remember swimmer ear is other name of diffuse otitis externa. That you should remember. Now next one, beta. Localized otitis externa. Localized otitis externa, called frunculosis or boil. Frunculosis or boil, beta. Frunculosis or boil. Localized otitis externa called frunculosis or boil, beta. Frunculosis or boil, beta. Look at see, beta. Can you see, beta? There is boil, beta. Okay. Can you see boil? Okay. Now, can you tell me? It is staphylococcal infection of the hair follicle, beta. Hair follicle. Can you tell me hair follicle are in the outer part or inner part, beta? Remember? Hair follicle, I told you, hair are in the outer part. Inner part has got no hair, but every time you see the hair over here, but if you go a little deeper in the external canal, you don't see any hair. So frunculosis is actually follicle of the hair got infected. So of course frunculosis will be seen in the outer part of the ESC only, beta. Now read your notes, beta. Read your notes. This is frunculosis, beta. Can you see fruncle over there? Can you see fruncle? Boil. In English, boil. Hindi mein foda. Fincy, foda is boil. Foda, fincy, boil. It is staphylococcal infection of hair follicle. It is seen in the outer part of the ESC because I know from anatomy, hair are only seen in the outer part of the ESC, beta. Okay. Now, one thing write down, beta. Treatment is IG packing, beta. What is IG? Write down. Icthamamol. Glycerine packing. Icthamamol, glycerine packing, beta. Icthamamol, glycerine packing. The special color pack, special solution is available. You'd soak some cotton in this medicine and put in the ear, beta. What is the name of the pack, beta? Icthamamol, glycerine packing. This medicine is a black color medicine, only used for frunculosis, beta. One more thing, beta. In this case, write down one thing. On side, write down. Examination in this case, write down tragal tenderness, also called tragal sign positive. Tragal tenderness or tragal sign positive, beta. If you press the tragus in this case, tenderness is what? What is tenderness? Pain on pressing. Tragal tenderness or tragal sign is positive, beta. Tragal tenderness or tragal sign is positive. Of course, beta. Look at screen, beta. I think it's not difficult to imagine. If you press this area, patient will have pain. You press the tragus, look at me, press the tragus in this area, patient will have a lot of pain, but tragal tenderness or tragal sign is positive. Am I clear, beta? Fine. Okay. Don't forget, icthamamol glycerin is MCQ. It is staphylococcal infection of hair follicle is MCQ. Tragal tenderness is the question, beta. Tragal tenderness or tragal sign positive, beta. Okay, very good, very good. I hope you're enjoying the process of learning. My concern is that your day should not be a very boring day. Your day should be an exciting day. You should look forward to learning these things as a doctor. That's why my main concern is. Now, malignant otitis externa. Malignant. It's infection, beta. Infection. It is infection of underlying bone of the ESC, beta. Please see, beta. It's not skin infection. It's infection of underlying bone of the ESC. ESC has got a bone. Okay, it is infection of underlying bone of the ESC, beta. It is infection of underlying bone of the ESC, beta. Okay, bache, fine. Look at screen, beta. This is your tympanic part of temporal bone lined by skin, beta. This is your external aortic canal, na? Pinna is over here, beta. Pinna is attached over here, beta. This is the real bony part of exonotory canal, beta. Okay. Now this red thing is the skin. Now, if the infection is only limited, in the skin, beta, here, it is simple otitis externa, yellow pus, beta. If the infection is only in the skin, it's called simple otitis externa. But if the infection goes into the deeper bone, beta, over here, this is called malignant otitis externa. Why? It's not a simple bone. Look at me, beta. It is making the skull base, beta. Can you see? This makes the base of skull. Hai na? Okay, that's why it's a very risky infection, beta. Okay, so look at your note, beta. It's infection of underlying bone of the EAC. It's also called skull base osteomyelitis. Okay, okay. That's why it's a life-threatening infection, therefore called malignant. Okay, it's not a cancer. On the right side, on the side, write down. It's not a cancer, beta. Don't confuse that it's a cancer, beta. It's not a cancer. Malignant word has come from English word. Malignant means life-threatening. Malignant, it's too malignant. Okay, it's a life-threatening infection, therefore called malignant otitis externa. It is seen in old diabetic patient, beta. It is in old diabetic patient, beta. Old diabetic patient. Typical question will be diabetic patient, beta. It is caused by Pseudomonas, very risky infection in diabetic patient, Pseudomonas. Think like a doctor. You are running your general practice. 60-year-old diabetic patient comes to a clinic and he says what? Clinical picture. Severe earache, beta. This is a learning for a doctor. A diabetic 60-year-old person to your general practice coming and he says, beta, I have got pain in the ear. Diabetic patient, pain in the ear. Think carefully. It may be beginning of malignant otitis externa. Severe earache. Number 2, blood-stained ear discharge. Doctor, there is some pus coming from a ear and it has got blood staining in that. Blood-stained ear discharge. Because bone infection will lead to granulation formation. You know, granulation is red in color, which bleeds also. Blood-stained ear discharge. Plus minus facial nerve palsy, beta. Very common, beta. Facial is the most commonly involved now, beta. Very commonly, these diabetic patient will have within few days facial palsy also. Why? This disease is eating the bone of the ear. Which bone? Temporal bone. And you know, facial nerve passes through the ear. And when facial nerve is passing through the temporal bone of the ear, then this infection eats the bone. It may eat the facial nerve also, beta. So facial nerve is the most commonly involved now. I told you it is skull base osteomyelitis. It's a skull base infection. And I know from your anatomy knowledge that many foramina of the cranial nerves are on the skull base. That's why 9th, 10th, 11th, 12th nerve palsy. Plus minus means maybe there, may not be there. Plus minus 9th, 10th, 11th, 12th nerve palsy due to skull base infection. You think logically, skull base osteomyelitis. Where are the foramina? Skull base, beta. Okay, examination. Granulation in the EAC. Granulation are red in color, beta. Granulation are red in color, like this kind of thing on the bone. And that leads to blood-stained ear discharge. Why there is blood-stained ear discharge? I hope you know from orthopedic knowledge, whenever there is osteomyelitis or bony infection, on that bone there is a red granulation tissue formation of pathology. And that granulation tissue will bleed and that's why blood-stained ear discharge, beta. Okay, treatment is, drug of choice is third generation cephalosporin. Pseudomonas, beta. Try to recall pharmacology knowledge of anti-pseudomonal antibiotic. The drug of choice is third generation cephalosporin, beta. Third generation cephalosporin. Third generation cephalosporin, beta. Okay, fine, beta. Third generation cephalosporins, beta. Let us revise this topic, but this is important topic. How this question will come, everybody? Let us discuss this topic, beta. Old diabetic with ear question is 100% malignant otitis externa answer, beta. I repeat, old diabetic ear question, it is 100% malignant otitis externa question. What is malignant otitis? Is it a cancer? It's not a cancer. It's a risky infection of the underlying bone of the EAC. It's a skull base osteomyelitis, and that's why it's very risky to the life of the patient. Typical profile will be old diabetic patient, beta. Okay, 60 to 70 years, beta. This is a typical question, 60 to 70 years, beta. It is caused by Pseudomonas. That's why drug of choice is third generation cephalosporin, beta. Okay, Pseudomonas, anti-Pseudomonal antibiotic, third generation cephalosporin. Facial nerve is very commonly involved. Diabetic old patient with earache, think about it. Okay, that's how we solve the question, beta. It's not that you know every nitty and gritty of medicine surgery, beta. You know the main thing, you know the answer. Oh wow, that's a difference between ulcerative colitis, Crohn's disease is important, beta. Mecal diverticulum has to come in the paper, beta. Colorectal carcinoma has to come in the exam, beta. You can't run away from that. Volvulus has to be there. It has to be there, beta. You can't run away from these things. Interception will be there, beta. Will be there. You can't really run away from that. So it's not that topics are really too hidden here and there. Yes, there are rare topics, but can we just bother about the rare topics and forget about the mainly asked 90% of the content of the exam, beta? No. I believe in smart preparation. I'm not saying forget about the rare ones, but yes, lay more stress on learning, revising the commoner things, do their question, get confident about the questions, and may God bless us, we see on that day those questions and we pass the exam, beta. Okay? Otomycosis. It is fungal infection of the ESC, beta. Now, it is also called the Singapore ear, beta. Lot of books have created controversy on this, but I'm changing it, beta, because this is a very controversial topic. Singapore ear is the word used for, again, moisture problem, beta. Fungal infection, moisture. They call it not bacterial infection, it's a fungal infection. Okay, fine, Singapore ear. It is a fungal infection of ESC. The most common fungus, again, not Candida, beta. Most common fungus is Aspergillus niger. Niger, ear. Yesterday, most common fungus for sinusitis was Aspergillus fumigatus. Yesterday was fumigatus. Today is ear, niger, Niger, ear, beta. अपने आप याद आता है, niger. Second common is Candida. It is more commonly seen in rainy season, beta. You know, coastal weather, Singapore weather, very, very humid weather. So that's why it supports it. Patient gets itching in the ear, beta. Itching in the ear. And when you look in the ear, there's a fungus colony in the ear, beta. Can you see fungus colony, beta? Can you see fungus spores over there? Little black, little white, and little wet also. Can you see, beta? There's a moisture here. Little black, little white, little wet. It is looking like a piece of wet newspaper. So examination shows which type of appearance? Wet newspaper appearance. Write down. Examination shows, very important question, wet newspaper appearance. The fungus colony gives which type of appearance? Wet newspaper appearance. Oh, wet newspaper appearance. Examination shows wet newspaper appearance. Wet newspaper appearance. Examination shows wet newspaper appearance. Okay. Treatment. Oral toilet. Oral toilet means clean. Toilet means clean, beta. Simple word, clean. Clean the ear, beta. Clean the ear, beta. Toilet means to clean the ear by suction. You have got a suction machine in the OPD. You suck the whole thing out, or by cotton you mop it and bring it out, beta. Suction or dry mopping with the cotton tip probe, beta. Dry mopping, beta. Will you do syringing in this, beta? You tell me. Apply your common sense. Can you do syringing by putting water in the ear to remove it? Can you do that? You should do that. No. Syringing, water, moisture will further aggravate fungus, beta. So dry mopping or suction. Don't do syringing to bring it out, beta. Okay? Okay, then you give antifungal ear drop like clotrimazole, nystatin, beta. You know better than me. The antifungal ear drop are many available. Mostly we use Candid ear drop, beta. Candid. You know, Candid is very common. What is Candid containing? Clotrimazole or nystatin, beta. What are two questions to be remembered, beta? Wet newspaper appearance is the MCQ. Fungus gives which appearance? Wet newspaper appearance. And second is, most common fungus is Aspergillus niger, beta. Otomycosis, two question is wet newspaper appearance and Aspergillus niger, bache. Okay. Now, exostosis. Osteosis, beta. Just write, E is missing, beta. Write down, beta. Exosteosis, beta. Exosteosis. It's also called surfer's ear, beta. MCQ. Swimmer ear is different. Swimming is different. Surfing is different. It is hyperplasia of bony EAC. Beta. It is also called surfer ear. It is hyperplasia of the bony EAC. Look at screen, everyone. This is exosteosis or surfer's ear. Beta. Can you see surfer ear? I hope you know surfing is a sea sport. Sea sport, beta. The sea salty water enters the ear of these sports people and that irritates the bone of the exonotory canal and that bone gets hyperplastic. Can you see, beta? Can you see extra bone formation here, beta? Can you see extra bone formation here, here, here? Extra bone ban jana, exosteosis. The name says that exosteosis means extra bone formation. This is a tympanic membrane and exonotory canal bone is hyperplastic, beta. Extra bone, extra bone, extra bone here. It is the hyperplasia of the bony EAC, beta. Am I clear, beta? Surfer's ear, beta. I will not confuse surfer ear with swimmer ear, beta. Surfer ear is exosteosis because the sea salty water entering your ear irritates the bone of the ear and bone gets hyperplastic. Extra bone formation, exosteosis. Okay, bache? Swimmer ear was diffuse otitis externa. Am I clear? Fine. Chalo, beta. It is more common in water sport person, so it is called surfer's ear, beta. So it is called surfer's ear, beta. So it is called surfer's ear, beta. It is more common in water sports person, therefore it is called surfer's ear, beta. Am I clear, bache? Fine. Okay. So can you tell me what is bat ear, everybody? What is bat ear? Bat ear is absence of antihelix. Boxer ear, cauliflower ear is after trauma, deformity of pinna. Swimmer ear was diffuse otitis externa. Singapore ear was otomycosis. Surfer ear was exosteosis. Don't you think so? All these should go to the 20th copy in those ENT pages, 5 lines about that. Don't you think so? Thyroplasty of larynx, 1, 2, 3, 4. Medialization, lateralization, shortening, loosening, lengthening, tightening. Indication of that should go into that 20th copy, beta. Such kind of things you will find in all subjects, beta. Very, very concrete, very sharp, very to the point things, very syndromes, triads, something like very unique. Transfer that too. But don't write it with every revision on there, beta. First you read the whole chapter, finish it off. Make a sense of that chapter. Then when you are revising the second time, at that time you transfer it. Don't in the first revision, don't do this, beta. Otherwise you write too much of data on that side, beta. In the second revision, keep that copy. And this copy will be reading when? From 28th May to 3rd of the June, beta. At that time. We'll be revising all the images of radiology, pathology images, surgery images, derma images, all telegram question shots taken, beta. Whatever question is like you like, take a shot, take a screenshot and save in that folder. All these things will be doing in a very smart way in the last 1 week before exam. Okay, let's take a quick break. Quick break. It's a 15-minute break. 15-minute break. And after that, we start the tympanic membrane. Let's get excited to know about our beautiful eardrum, beta. You know eardrum? So come back to me after 50 minutes to learn about your eardrum, beta. Eardrum. Okay, chalo.